Stroke is a brain attack that can affect how the body functions, as well as how we think, feel, and communicate. There are three key types of stroke. The ischemic stroke, which is essentially due to blockage of blood supply to a part of the brain. The hemorrhagic stroke is due to bleeding in or around the brain. And the TIA, or transient ischemic attack, is essentially, or people call it mini stroke, is also stroke, except for the fact that the symptoms don't last as long as stroke, maximum of 24 hours, due to temporary blockage of the arteries. Main risk factors for stroke can be divided into those that you can change or do something about, and those you cannot do something about. Now, let's start with risk factors that you cannot change, such as age. Stroke happens more often in people who are older than age 55. The reason for this is because arteries harden with age. In the UK, 1 in 4 strokes happen in people under the age of 65. People from South Asian background, Black African and Black Caribbeans tend to have increased incidence of having stroke. The reason for this is not quite clear, but it may be connected to the fact that in this ethnic group, they have increased chance of having conditions such as hypertension and diabetes. Family history: if a close relative happens to have a stroke, then the individual's risk is higher. Genetic conditions: some genetic conditions such as sickle cell disease can predispose those with such conditions to stroke because of the same phenomenon of blockage of arteries to the area of brain. There are risk factors that you can change. These include medical conditions such as high blood pressure, diabetes, high cholesterol, and atrial fibrillation. Of course, to reduce these risk factors, it is advisable for individuals to go to their GP to see how best to manage them. There are other risk factors such as lifestyle. That includes being overweight, eating unhealthy food, smoking, and drinking excessive amount of alcohol can all cause problems with the blood vessels and increase chances of having high blood pressure and make it easier for blood to clot. Stroke can affect different people in different ways. For most people, the impact is relatively minor. For some, they can have quite severe and long-lasting impact that stay for a longer time. The difficulty with movement of balance is due to a combination of factors such as muscle paralysis or weakness, muscle stiffness, or otherwise known as spasticity, and poor stamina. The difficulty with movement of balance usually occurs on one side, making it difficult for the individual to walk or use a function in their upper limb. Emotional changes such as depression and anxiety are very common after stroke. Apart from emotional problems, psychological issues such as memory and thinking, as well as difficulty with planning and organization, can be a real issue for people with stroke. Communication issues are very common after stroke. Aphasia is when people have difficulty with speaking or understanding what others say to them. Dysarthria is when the muscles of the face, mouth, and throat are poorly controlled by the individual as a result of stroke. Apraxia is when the individuals cannot move the muscles of their mouth or throat. Pain and headaches are also common after stroke. The pain can be one-sided, the side that is affected by stroke, and can be quite disabling for the individual. Some people call it post-stroke syndrome pain or neuropathic pain. Visual difficulties are also very common after stroke and include visual field defect or our panoramic view, visual neglect, and visual perceptual deficits. People can have swallowing difficulty, otherwise called dysphagia. Continence of bladder and bowel problems are common after stroke and usually worse in the first few weeks of stroke. Most of these problems will settle with time. Excessive tiredness or fatigue is a common symptom as well after stroke and can in fact be quite disabling for some patients. Epilepsy, or otherwise known as post-stroke epilepsy, which is essentially repeated fits and seizures after stroke. For movement and balance, most people will see significant improvement in the first few weeks. However, the earlier people start moving, the better the outcome. Physiotherapies are very crucial in how people go about improving in stroke for those who have residual impact. For example, they will help the individual with balanced exercise programs. They will help the individual with improving their stamina and reduce dizziness. They can also help with issues such as muscle strengthening exercises. And of course, they will help with issues with ability to transfer, standing and walking. Swallowing problems also tend to settle for most patients. However, there are those who are at risk of aspirating their food, and then the speech and language therapies will help with identifying what sort of food or fluid consistency that an individual with stroke will have. For a few individuals, they may require a feeding tube in order to reduce that dangerous risk of aspiration and causing problems in the lungs. As I said earlier on, pain and headache can be quite disabling, and various modalities can be used to manage this. Medication is a key example of how a patient can have their headache or pain improved. Physiotherapists are also very good in helping individuals to manage these symptoms. Spasticity and spasms, which can be associated with pain, can respond to medication and Botox or botulinum toxin injections. Continence problems can be managed with medication and bladder training or bowel training. Physiotherapists can teach individuals to do pelvic floor exercises. Most communication difficulties will settle within the first 3 to 6 months. However, there are some communication difficulties that will continue for months and years. Even if this happens, Speech and language therapies can help people communicate better or teach individuals how to read, write, and function within the context of their homes and community. As I said earlier on, depression and anxiety are very common after stroke. I think the starting point is for individuals to go to their GPs to have a discussion about the options that can be available. There are lots of treatment options that can help, including medication and therapies, including counseling. As we have learned, stroke is very common, and individuals can maximize their functional independence through quality rehabilitation.